First, CLL patients are often put in watch and wait when they're first diagnosed. What does that mean?
So watch and wait means observation. CLL is a slow-growing cancer generally, and one of the few cancers that's managed by observation if it's not causing any problems to the patient. These problems could include symptoms in the form of fatigue, unintentional weight loss, symptomatic enlargement of their lymph nodes or spleen, or we could see changes in their blood work in the form of decreased hemoglobin or decreased platelets. If this is not happening, observation is still the standard of care. And data from this comes from a number of clinical trials where patients were treated based on just having the disease without having any of the symptoms or signs I just mentioned. All these studies had negative results, meaning that starting treatment at diagnosis did not affect the overall survival of these patients. These studies were, however, done in chemoimmunotherapy era. Now we have targeted agents, and also now we are able to define CLL better, which means that we are able to predict who has high-risk disease. So there's renewed interest in these, what these are called early intervention studies. But until we have those results matured and available, watch and wait is still the standard approach. And during watch and wait, we see patients at regular intervals. We assess them for symptoms. We look at their blood work. And one of the main reasons for seeing these patients at these regular intervals is to reinforce what symptoms we want them to pay attention to. So educating patients at each visit is a very important part of these visits. Watch and wait may be all that 1/3 of our patients may need through their lifetime. They may never need any CLL-directed treatment.